patients. Dr. Taylor here to discuss your clinical breast exam. I know you aren't used to seeing me look like a doctor, even though I am a doctor. But today it's apropos. I never wore my white physician's coat much, even back in the day when I was practicing obstetrics and gynecology full time. I wore it in my office while seeing patients, but I never wore it anywhere else. It was just too stuffy for me. And it really never could compete with my beautiful feminine clothing. So I never even wore it to medical conference or events that were just doctors. And that reminds me of an incident that occurred at a medical conference. We used to have a monthly staff meeting for all the obstetricians and gynecologists in the Texas Medical Center. And it was always early in the morning on the first Monday morning of the month, so it was a breakfast meeting. And we held it in a big conference room in one of the hospital buildings. You know, the Texas Medical Center is the largest medical center in the world. Literally. It's huge. It encompasses blocks and blocks and blocks. Jokingly, we refer to it as a metastatic cancer because it just goes on and on and on. There were about 150 obstetrician and gynecologists in the Texas Medical Center alone, but only about half showed up at any one meeting. You know, things like emergency C-sections, rounding on your patients, or starting early surgery sometimes interfered. Well, these meetings covered all the new rules and regulations and such. They were really boring. In any case, upon entering the room, there was always a big, long conference table bearing all sorts of breakfast food items, coffee, tea, etc. And there was also a sign-in sheet. They kept tabs on attendance. We had to attend at least an arbitrary minimal number of these boring events, just so we knew what was going on. And in the main space of the conference room, there are multiple long conference tables placed end to end to create this huge rectangle. And the rectangular formation made it so that everyone could see everybody else. And sitting at the tables, as you entered, of course, were typical physicians. Balding male physicians in scrubs and white physician's coats, and plain, fit in with the guys, female physicians in scrubs and white physician's coats. The attire in the room was so homogeneous that it really looked like there was a mandatory uniform for these meetings. Well, one day I entered the room dressed in one of my typical, pretty, feminine, flowing dresses without my white physician's coat. And on this particular day, I was wearing pink. And apparently, because I was not dressed in the usual physician attire, my entry attracted some attention. However, I didn't notice that I was attracting attention. But as I was signing in on the sign-in sheet, Dr. Kaufman, the chairman of the department and a world-renowned physician, said, "Dr. Taylor, what are you running? A gynecology practice or a fashion show?" And I stopped. I looked at him. I cocked my head, shrugged my shoulders, and said, "Well, I guess it's a little bit of both." And one of the female physicians said, "Heck, the only reason I come to these meetings is to see what she's wearing." So I have never fit the mold. But today, I'm going to explain clinical breast exam by your physician. And I thought it would be most appropriate to dress the part, even though I rarely look the part. Needless to say, I was not your typical physician when it came to performing the clinical breast exam either. In my book, both first and second edition, I give you great detail on how to perform your self-breast exam, but very little detail on your doctor's clinical breast exam. Obviously, part of the reason is that you do your own self breast exam, so you need more guidance on that. But that's not the only reason I provide so little information on the clinical breast exam done by your doctor. There are others, and this video will help you understand them. So today, I'm going to teach you about the clinical breast exam your doctor does in the office setting. That's the patient. And we're going to compare it to what you learned last week about the self breast exam you do at home. In video number 390, I taught you that 70% of breast cancers are diagnosed by radiologic breast exam, which can see breast cancer early, while 30% are diagnosed by either self breast exam or clinical breast exam, which can feel breast cancer early. So today we're talking about the 30% of breast cancers that are diagnosed by one or the other means of feeling the cancer, and we're going to compare the two. We'll also create a chart as we go along, recording each comparison. Here's the skeleton of our chart. All you see here thus far is the empty chart. The first column designates all the factors of self or clinical breast exam that we'll be comparing. The second column is for self breast exam, and the third column is for clinical breast exam. As we fill the cells, we'll color code it according to which is superior, self breast exam or clinical breast exam. For each parameter of comparison, we'll use red for the inferior exam and green for the superior exam. I like red and green because they are the colors for stop and go. Or you could say red is rotten and green is good. So the more green there is, the better the exam is. So let's start with the first item on our list, timing. And we'll compare timing of your self breast exam to timing of your clinical breast exam. In the last video, you learned that there are critical timing rules for performing your self breast exam. You discovered that it is not something you can do just any old time. If you're having cycles, either your own or imposed by hormones, it is absolutely critical to perform your self breast exam just after your period finishes. This corresponds to day 4 to 6 for most women. So with your self breast exam, you can time your exam perfectly so that your breasts are the same every time you check them. You have total control, and the timing can always be precise. What about the timing of your doctor's clinical breast exam? You see, you have to call and make an appointment, and even if you specify the exact day on which your breast exam is due, your doctor may not be seeing patients in the clinic that day, or the schedule may already be booked for that day. Or the ideal day may be a Sunday or holiday when the office is closed. So no matter how carefully you may plan for the timing of your clinical breast exam, there are things beyond your control. And as a result, the timing will be imprecise. That means self breast exam offers precise timing, while clinical breast exam does not. So on our chart, we'll indicate that for timing of breast exam, your self breast exam is clearly superior and gets the green color designation. Next, we have frequency of breast exam. In the last video, you learned that you perform your own self breast exam every month. This means, depending on whether you're having cycles or not, you will perform 12 to 13 self breast exams each year. That gives you 12 to 13 opportunities to detect breast cancer early, and the earlier, the better. So 12 to 13 times a year is really fantastic. But how often do you see your doctor for your general checkup? A general checkup is the kind of office visit that includes a clinical breast exam. There's another name for a general checkup. It's commonly known as an annual exam. Oh my, that means it occurs annually. So your doctor's clinical breast exam is going to occur on an annual basis. That means your doctor will examine your breasts only once each year. So let's see, 12 to 13 times per year versus once a year. Which sounds more beneficial to you in terms of detecting breast cancer early? Would you rather detect it as early as humanly possible by palpation, or would you prefer to find it a full year after humanly possible by palpation? You see, here we have yet another reason that your self-breast exam is superior to your doctor's clinical breast exam. So on our chart, we'll give your monthly self-breast exam the green color for good, and your doctor's yearly clinical breast exam the red color for rotten. The next parameter is who. This refers to who does the breast exam. When it comes to your self-breast exam, you do it yourself. You, the one and only you. Not your husband or wife, not your boyfriend or girlfriend, just you. And because you are the only person who ever does your self-breast exam, you don't have to worry about being unavailable for it. You are always with yourself, and your breasts are always with you, and so are your hands. But what about your doctor's clinical breast exam? Do you always see the very same doctor? Or do you sometimes see the doctor's partner? Have you had the same doctor ever since you grew breasts? Or have you changed doctors from time to time? Or what if your doctor practices in a teaching facility and a medical student or resident does your clinical breast exam from time to time? What if the doctor is absent unexpectedly on the day of your appointment? What if your doctor has to run off to deliver a baby? What if your doctor is stuck in a medical or surgical emergency? Or what if you change doctors or your doctor retires? Or what if you're fed up with doctors in general and you're in doctor shopping mode, going to a different doctor every year in search for one that's right for you? All these things mean that the very same doctor may not be checking your breasts each year. So because your self-breast exam is always done by the one and only you, while your clinical breast exam is done by any number of medical professionals, your self-breast exam wins. So on our chart, once again, we'll give your self-breast exam the green for good and the clinical breast exam the red for rotten. Next is familiarity. This refers to how familiar you or your doctor is with your breasts. So what do you think? With your self-breast exam, you yourself check your own breasts once every month. And how many other breasts do you check? Oh, nobody's? Well, then that would mean that you only know one set of breasts, doesn't it? And it would mean that because you check them 12 to 13 times each year, you check your breasts more often than anyone else does, too. And if you check your breasts more often than anyone else does, you'll know your breasts better than anyone else does. That's the very purpose of self-breast exam, to be the world's greatest expert on your own breasts. You know if an irregularity in your breast is normal for your breast. And if it's normal, there's no need for concern. So your self-breast exam is tops when it comes to familiarity with your breasts. What about your doctor's clinical breast exam? How often does your doctor check your breasts? Once a year? And how many other breasts does your doctor check? Dozens every day. I've often joked that I've seen more T and A than any man. It's crass, but it's true. Your doctor spends all day, every day, looking at boobs and butts. So while your doctor checks a lot of breasts, he or she does not check only yours, nor does he or she check yours very often. If your doctor discovers the same irregularity in your breast that you know to be normal, he or she has to pose all sorts of questions. He or she has to establish whether or not to be concerned. You already know what's normal, so you don't have to wonder. If you're checking your breasts every month, and you never check any breasts other than your own, but your doctor is checking dozens of breasts every day and only checking yours once a year, there is no contest as to which of you is more familiar with your breasts. You are. Familiarity is what enables you to detect breast cancer early. The better you know what's normal for your breasts, the easier it is for you to detect something that's abnormal for your breasts. So your self-breast exam wins when it comes to familiarity with your breasts. We'll give self-breast exam the green color and clinical breast exam the red color for this. Now we have location. This refers to the location of the actual breast exam. For your self-breast exam, you're at home. At home, you obviously have the comforts of your own home, and just about everything is preferable at home these days. Face it, home is home. So you don't have to go anywhere in order to perform your self-breast exam. But for your doctor's clinical breast exam, you won't be staying at home. Nope, you've got to go to your doctor's office. Now, this is more of an inconvenience than anything else, because the actual location of a breast exam is not critical, but all the other things that are part of the location are. And there's no doubt that home wins over office when it comes to location. So let's just go ahead and put location on our chart and then discuss all those other things. What about privacy? When you're at home during your self-breast exam, you have the ability to control your right to privacy. You can go into your bedroom, lock the door, turn off your phone, and do your self-breast exam in complete privacy. But when you go to your doctor's office for your clinical breast exam, you have privacy only to the extent that the office allows. You probably have an exam room to yourself, but you can probably still hear other things going on in the office. You certainly can't lock everyone out of the room. And even though the only person you need in the room for your clinical breast exam is your doctor, it's possible that there may be a nurse, medical students, or a scribe in the room too. You have no control over the privacy you have in your doctor's office. So your self-breast exam wins the privacy contest over your doctor's clinical breast exam. All right, what about time? This refers to how long it takes to actually perform the breast exam. When you do your self-breast exam at home, you can take as much time as you need to do it properly. You learned in the last video that all self-breast exams take at least 15 minutes, regardless of the size of your breasts. It can take up to 30 minutes. What matters is that you take the time to do it properly. If it takes 30 minutes, fine. You can perform your self-breast exam at a time when you have plenty of time. But that's not the case for your doctor when he or she performs your clinical breast exam in his or her office. Most appointments are for only about 10 or 15 minutes, and that's all the time your doctor has available for your clinical breast exam. Oh, but that's not all he or she has to do in those 10 to 15 minutes. Your doctor also has to discuss any problems you're having, do a pelvic exam, perform a PAP or an HPV test, perform any other exams depending on his or her area of expertise, log the exam findings into the computer, send prescriptions to your pharmacy, all in those 10 to 15 minutes. In most cases, the 10 to 15-minute office visit is the total time you spend in the exam room with or without the doctor. Most of the time, you end up being face-to-face with your doctor for only about 7 minutes. So if it takes you 15 to 30 minutes to do your self-breast exam, how in the world is your doctor supposed to do a clinical breast exam in less than 10 minutes? Something has to give, and that's the next thing on our chart. So you have plenty of time to do your self-breast exam, but your doctor has very limited time to do your clinical breast exam. Let's go ahead and record the time differences between your self-breast exam and your doctor's clinical breast exam on our chart, and then we're going to move on to what gives. In last week's video, you learned that there is a very specific technique for performing a proper self-breast exam. Anything that interferes with or distorts that technique will impair your ability to detect breast cancer early. Specifically, you learn that all the following are necessary to adequately palpate all your breast tissue. The position for breast exam requires lying down on a flat surface. The arm on the side of the breast you're checking has to be behind your head. You have to go around your breast in a circular pattern covering your entire breast and pressing down to your rib at each spot. And you have to press up into your armpit. So do you think these same things are important for your clinical breast exam? Well, of course they are. Breast tissue is breast tissue, and examining it in a way that can detect breast cancer is going to be the same regardless of who does the exam. The only difference is that your doctor can use 2 hands to do your clinical breast exam, whereas you can only use 1 to do your self-breast exam. Other than that, nothing changes. So, for a clinical breast exam, you are able to lie down on a flat surface, which is the exam table. Although some doctors don't even have you lie down. You are also able to put your arms behind your head, although some doctors don't even have you do that either. But that's where the accuracy and technique ends. Because since your doctor has limited time, he or she is not going to be able to cover your entire breast. Doing so would mean systematically palpating your breast tissue in the same clock-face manner that you use for your self-breast exam. But instead of doing that, and because they can use both hands, most doctors just mash around on your breast in no organized pattern. Most doctors do this rather than this. It's very different. And I must say that I have yet to see a doctor press all the way down to the rib. Instead, they just kind of touch lightly, skimming the surface of your breasts. And this is bound to miss some things. Add to that the fact that many doctors fail to adequately palpate your axillary tail of breast tissue way up here underneath your armpit. So what gives is technique. And if you give on technique, you forfeit the opportunity to detect breast cancer early. So when it comes to technique, your self-breast exam is likely to be more proper than your doctor's clinical breast exam. And the shortcomings of a clinical breast exam can be in any area of technique: position, arm placement, palpation of the entire breast, depth of palpation, or examining your axillary tail. So I'm going to add all of that to our chart. So now I've filled in the cells for all the things having to do with technique. And you can see that your self-breast exam is superior for all of them. Now we come to interruptions and distractions. I'll address these together because where you have one, you have the other. Interruptions are not beneficial for anything. To do a proper breast exam, you need to have time dedicated to nothing but the breast exam. Interruptions set the stage for losing your concentration. And that's precisely what distractions do too. They cause you to lose your concentration. When you do your self-breast exam in the privacy of your own home, at a time when you know you won't have interruptions or distractions, you set the stage for a very thorough, focused exam that is unlikely to miss anything. Once again, you have control over the environment, and that control can save your life. But such is not the case in your doctor's office. It's a busy place with all sorts of things going on. Your doctor's time availability for your clinical breast exam is already truncated by the short appointment time. And during that short appointment time, your doctor may have interruptions. The nurse may inform the doctor about a patient in labor. Or the receptionist may interrupt to notify the doctor of an emergency. Or the doctor may get paged. Any number of things can serve to divide the doctor's attention between your breast exam and whatever else is going on. And every interruption or distraction can set the stage for missing something. So when it comes to the absence of interruptions and distractions, your self-breast exam wins hands down over a clinical breast exam. So now we can complete our chart. Can you believe it? There isn't one single thing about a clinical breast exam that is superior to your self-breast exam. Now, if 30% of breast cancers are diagnosed by either self-breast exam or clinical breast exam, and there isn't a single thing about clinical breast exam that is superior to self-breast exam, which of the two do you think finds the most breast cancers? Self-breast exam, hands down. And yet, the guidelines recommend against self-breast exams, believing that women are incapable of performing them. I've never heard of anything so ridiculous in my life. You are much more capable than anyone else on planet Earth at performing a breast exam on your own breasts. You know, this is in keeping with a wonderful quote that goes, "The best place to find a helping hand is at the end of your own arm." Oh, that feels so much better. Do not relinquish your power. Now, I could have just presented the clinical breast exam in isolation today, but that would have missed the point. The point is to do both your self-breast exam and your clinical breast exam Both. They're both important. But as with so many other things about menopause in general and breast cancer in particular, people have gotten the importance of the two upside down. Be sure to do both your self-breast exam and your clinical breast exam. And you can find our summary chart in either the description box via the link, or you can go to menopausetailor.me. Now, there's one more piece to breast exams, the radiologic breast exam. So that will be our topic for next week. It's just so important for you to understand the part that each of these three exam methods play. The goal is to detect breast cancer at an early stage when it's curable. And you will never do that if you do only one of these three methods to the exclusion of the others. They all belong together. You need all three if you want to catch breast cancer at the earliest possible stage. You also need all three of my offerings, a consultation which you can schedule at menopausetailor.me, subscriptions to both my channel and my newsletter, and time to follow me on social media. So this is where I'll leave you today. Come back in a week for a tutorial on radiologic breast exam. It will not be what you expect. I promise. You're probably realizing that most of what I do is not what you expect. Bye!